This conference will now be recorded. This conference will now be recorded.
All right. Good morning, everybody. Welcome to, this is the December 15th, 2025 meeting of the Belchertown Opioid Settlement Funds Advisory Committee. We are here in Town Hall, a number of us, as well as guests online. Thank you, Lauren, for joining us. And we are recording the meeting on the GoToMeeting platform, so it should be available for anybody who may want to watch it at a later date. So I'm going to call the meeting officially to order. My watch says 10:14 a.m. on this December 15th. Call the meeting to order. I think everybody knows everybody here. I don't know, again, if anybody, if maybe just really quickly we'll do intros, just in case anybody does watch the movie, the film, the recording of this and wants to do that. So I will start maybe with Lauren, who's with us online.
Hi, folks. Good to see all of you at various points as the camera moves around. Lauren Kelly, she, her, Hampshire Hope Coordinator.
Great. Thank you.
I'm a Berthium. I'm the epidemiologist for the Quebec Substance Use Alliance.
Great. Welcome. Two of our guests here, and we've got three committee members here.
Drug Free Communities Program Director Chris Hogue.
I'm Gail Grammarosa. I am officially the community member of the committee, and I'm serving as the chair.
I'm Emily Kirby. I'm sitting as the QHSUA chair.
Great.
Or not chair. You know what I mean. It's Monday.
It's Monday. Representing.
Yeah.
Everybody's here representing. Thank you to everybody who is here. We got a couple of discussion items, some stuff that came up since our last meeting in November. And I know we also want to spend some time talking about the resource program, the community wellness resource fair, kind of a thing that we are attempting to do at the library. And then we'll do some quick updates on the most recent appearance in front of the select board. And then we'll just decide our January meeting date. Just as a reminder, as we get into January, February, and then some other months, we often hit those Monday holidays. So just a preview of coming attractions that we'll probably just need to think about our meeting dates in contrast to those holidays when Town Hall is officially closed and the schools are closed. So first discussion item, and I'm interested, this came up in relation to an email that Jill Rossi, the town accountant, got, and then she passed it on to me. And Lauren, I'd really appreciate your input depending on what you've heard statewide. We had a for-profit treatment provider named Acadia Health just send, I think Jill is on the state level website as a contact person. So they sent an email saying, you know, as a committee and as a municipality, are you open to funding for profits? Are they eligible? Are they not? So I wanted to just get people's input on that, as well as I sent a technical assistance request to the Rise Mosaic people, but I haven't heard back from them. And again, Lauren, I don't know if you have more information, if anybody has or hasn't funded for a profit, how we should think about that. They are a treatment provider. Acadia has programs in Western Mass as well as in Eastern Mass. So they're pretty large from what I could gather on their website. So thoughts or what we know about anybody using opioid dollars for a for-profit entity?
I haven't seen anyone do for-profit.
For-profit
journeys, and I think there was at least one municipality, it might have been Milton, when I was on like the Rise meeting the other day, that specified for their mini grant that you had to not be for-profit.
Had to not be,
if I'm
okay.
remembering right.
Okay.
But it would not surprise me if that's a stipulation for a lot of municipalities.
Municipalities, yeah. Just as a reminder to all of us, so yeah, we have never funded a for-profit so far, right? We've got Honest Beginnings and Boat and schools and drug-free funded. So yeah, we have not ever, and even in our grant application forms, we don't list for profit as an option. We have like nonprofit, governmental, individual, blah, and then other,
Yeah.
but we don't list for profit. So other thoughts about,
So I just looked up information on it really quick.
yeah, okay.
So it just says that generally no,
Okay.
it's not meant to generate private profit, which says what it can be used for, which is all things that we already know
Yep.
what it's used for. Let's see, can be used for profit sometimes to deliver approved services.
Okay.
So maybe a one-time service or something, I would think, I don't know, under a contract or a grant.
Okay.
It's usually restricted or capped.
Okay. Gotcha. Okay.
Must be reinvested in opioid abatement, not distributed to owners or shareholders.
Right.
Yeah.
So.
Right. So I'm imagining, yeah, there would be,
So like if they want to implement a new program that they weren't getting revenue for, maybe
Okay.
they could do that. So like if they wanted to do one day event that they couldn't charge people's like insurance for or something like that,
Gotcha.
maybe then it would be okay.
I feel like it's hard to keep track of that though.
Yeah.
I know, right.
Yeah,
I
it says-
hear the concerns and the constraints that we might want to think about.
The examples are for-profit treatment provider being paid to deliver services, a pharmacy paid to distribute naloxone, which I think is interesting.
Well, maybe for free instead of charging people for it.
Oh,
Yeah,
fair enough.
yeah.
Yeah.
And then
Okay.
training company paid to conduct evidence-based education, which,
Okay.
yeah.
Yeah, if
So-
you're like paying someone to do like a community program, the community doesn't have to pay for that.
Right.
And right, and
That's-
again, right, and a
Yeah.
treatment provider would not be billing,
Yeah.
couldn't necessarily bill for that,
That's,
right? So
yeah, that's the key.
it sounds like it might be a very narrow window.
For example, there, like out in, I can't remember the name of the program off the top of my head, but last year we had a program reach out to us, Aline and I, and we talked to them. And they wanted to come into our schools and do a mental health services program. So like, we would, like our counselors would refer them to treatment,
Okay,
but we would pay them. We would have to pay them to do
Yeah.
this, and it was
to
like
do the training.
wicked
Yeah,
expensive,
okay,
like
yeah.
super expensive. We're like, yeah, we can't afford to do that.
I
So
know,
those
I
are the,
think
some
that would be,
for-profit organizations do look to bring their whole programming into a certain school, and I don't see us giving
Right.
that, I don't know. I think it depends.
Mm.
It'd be like, if it was like a scholarship type program, like if there was opioid settlement funds given to a treatment provider who would then at no charge to like an individual, like provide
Yeah.
services,
Right.
like that might be,
Right.
Yeah.
Like a scholarship for treatment.
Yeah,
Yeah,
exactly, like
right.
that's something I
Right.
can see being
Right.
a valid way
Right.
to go about it for a
Yeah.
for-profit
Yes.
organization, but like,
Right,
I don't know, it's one of those things I'm like, I don't want you making money, but.
I know, right.
Yeah, I just don't feel right about
I
that.
know, I hear
either.
that concern, right, I hear that
But
concern,
providing free
and
services to someone
That's
who might
different,
not
right.
able, be otherwise able to access
Right.
them.
Yeah.
I know that,
That's different,
that,
right.
that almost sounds a little bit more to me, similar to those enrollment fees
Yeah.
Yeah,
that we're helping people with. The town is helping folks when they enroll into Honest Beginnings, which is a
yes,
a
yeah,
nonprofit,
absolutely.
yeah. The other thing I saw, just sort of on an even broader level, both in Massachusetts and maybe even across the country, depending on where you are, there was some mention of, if that's the only treatment provider you might have.
Yeah.
And we're lucky that we have lots of nonprofits, they may not be right here in Belchertown, but they are at least in the region, they're in the county, they're nearby. But in other parts of the nation, I think there are places where a for-profit hospital and a for-profit
Yeah.
maybe behavioral health care
Mhm.
provider is the only option.
Yeah,
Um,
That's true.
Yeah. Lauren, has this come up in any other town that you're aware of? in
I
Hampshire County?
haven't. No, the only knowledge I had of this was actually through the outreach that Belchertown had received. I think Neil had forwarded it to Kathy Catuño, who then shared it
Okay,
with
yep.
me, seeing if I had been familiar or kind of if I had any guidance on how to kind of navigate. So I think it was the same outreach that y'all are also navigating is what I have been familiar with. And I think a lot of the concerns that many of you have raised, I think were some of what I had come up for me. I think I think what Gail, you were just speaking to a little bit is, well, it does sound like they do provide maybe some services to folks in Western Mass. I think really thinking about, in addition to all the other concerns that have been named, of how are we using this money to really support like community-based efforts. So like, even if it was a for-profit business that was doing something directly within our communities in Hampshire County, in Western Mass, I think it would be different than like this larger company that maybe has like a touch point in Western Mass, but isn't necessarily like a small, like upstart, you know what I mean? Who's really trying to be more like community driven. So I think I had a lot of hesitations and concerns. So, echoing what everyone else has shared and then just adding in that other piece, I guess.
Yep. That makes sense. And if I remember right from their website, we're not talking about stuff that's super close either. I think they've got some services in Springfield. They might have something in Holyoke, but again, they're not, like you said, and not surprisingly, given that they're, a fairly large corporation. A lot of their services are obviously in Eastern Mass where there's, larger population centers and whatnot. So they have Boston, Cape Cod, they've got Lowell, they've got some stuff in Middlesex and Essex counties out there. So yeah. And again, based on all of our conversations, even about providers who are not necessarily physically based here, I feel like we've got nonprofit hospital, we've got BHN, we've got Tapestry, we've got other places that are all under that nonprofit umbrella. That I think for me as well, I don't necessarily see the need to open up to, the scholarship idea, if that were to come up as a way to support that. But again, I think it depends on, what are the other options? Even for inpatient treatment, we still have multiple nonprofits that you could take advantage of for inpatient treatment. If we were to say, we wanted to support someone, trying inpatient or intensive outpatient treatment. Anyway.
Was there any additional communication where they or were they just like, can we have some of your money?
Well, basically,
I
know their simple question was, are for-profits eligible under your guidelines? So I think, and my guess might be that, I guess if I were them and I had that same question, I'd be asking that of a bunch of municipalities, maybe across the state.
Yeah.
Just as they're trying to gauge what resources might be available to them.
It would have been helpful if they had suggested what they would
do with it.
I know, right.
Been a little more
Right.
warm about
Right.
it.
Yeah.
Right. Well, here's a couple of thoughts I have. You all tell me. I'm glad to, hear what everybody's thoughts are. I think I'm hearing some degree of consensus that we're not necessarily looking to rush into allowing for-profits to apply. Let me see if, what kind of information I get back from Mosaic and the RISE folks there. Good to hear that it hasn't come up in other places because again, or nearby places, we have lots of nonprofits here, and go from there. I don't think we have to make any final decision today based on what we might hear from RISE and then maybe further discussion at our next meeting. I'm open to the idea that ultimately, if we want to make a really strong stance that we are not looking to have for-profits be eligible or only under very limited specific circumstances, we could write that into our grant making documents. For now, nobody's applied, there's no for-profit proposal on the table at all.
I mean, I guess we could say you can apply, but that doesn't mean we're gonna It depends on the
Yeah.
project.
Well, and I guess the other thing too, before we even, whether we do or don't put something in our grant making documents and or, think more about it, I might want to get input from the select board.
Yeah.
Because they may have,
Yeah.
we could go through the exercise of having a for-profit think that they might be eligible, and then the select board might challenge that, understandably so. I think they would have some of the same concerns about what that means, and that these dollars maybe are better suited to other kinds of nonprofit entities, government and, and nonprofit agencies as well. Cool. If anybody runs across anything, or Lauren, if you hear anything or see anything, like I said, just feel free to share it. I just wanted to bring it up today, and we'll talk more about it at a future meeting. But for now, nothing definitive needs to change. Cool. All right, next item on our agenda. Any subcommittee meeting between our November meeting and today? Yes, there was. All right, cool. What's updates from
Yes,
the subcommittee?
so, I did not reach out to Brendan after I told you that, by the way, yeah, remember that?
Yeah,
Um,
yeah.
anyways, I reached out to Boston Bullpen and spoke with them directly. So the way that they do this is when a family members for the family support program, if a family member has somebody that passes away,
Mhm.
they go to the Halo website and they fill out the application directly from Halo. So, Brendan runs that, and
That was one of our guest speakers.
yes,
way back
yes.
then, right,
And so
Brendan?
he
And-
runs that,
Yeah.
and what this guy was saying, Steve, he said that, Brendan does as fast as he can, tries to verify the death. Like, that's really important to verify that, whether it's like, a medical examiner gives him
Okay.
the report,
Mhm.
or EMT or police. So he has to
Okay.
confirm that first,
Yep.
and, or be very confident, because they want to do a quick turnaround with it. So right off the bat, once that application comes in,
Yeah.
whoever that, if we did that here,
Right.
like had some type of application, we have to have some point person that is going to be like on it right away,
Fast.
right? Trying to figure out, like, and
Yep.
confirm the death. So, that was the one thing. Once it's confirmed by Brendan at Halo, he contacts Steve from Boston Bullpen. Once the application is approved, it's approved as soon as they verify the death. As soon as that application is approved, he contacts Steve from Boston Bullpen. Within 24 to 48 hours, he contacts the family directly
Okay.
and asks the family, what services
Right.
whatever they're applying for on the application. If they apply for funeral services, he connects with them, to find out what the funeral home is, if they didn't say the funeral home. But, otherwise, he might just contact the funeral home, but he'll let the family know that your services are accepted, contacts them.
Right.
But he said there's a list of, like, funeral homes that they use that they can connect to. Like, we're really short with funeral homes in our area in Belchertown. So, likely, Bears and Story is definitely gonna be the one funeral home that we connect with for sure. But, I'm not really familiar with others in the area that people would utilize.
That they might utilize.
But if it's a person that is from Belchertown and their loved one passed away in Holyoke,
Yeah.
maybe they're gonna use a whole, but
Right.
but at least if we have one, one connection that most people likely would use. So he would contact the family, let them know, like, what services. He said that it was, let's see, it's about a $5,000 allocation is what they get, the maximum.
I think I remember that from their application masthead.
Right. And so what the funeral home does after they connect with them is they send the invoice directly to Boston Bullpen. The family does never, ever touches the money,
Right.
ever. So, he said that out of the 52 families that have utilized these services, 48 out of 52 have used it for funeral expenses, like funeral itself, the headstone, or cremation services. So that's 4 people that used it for other things like mental health support or grieving support, but it was mostly used for funerals. Yeah. So I mean,
Which I think is,
it sounds like a
the
pretty
biggest need.
cut and dry
Right.
thing too. It's
Right.
just a matter of like, who's that point person, but also, you know, the other thing that I was thinking about, okay, so like say the application comes and say that, you know, I'm the point person, right? I get the application, I find out as soon as I can about the family, I confirm the death is from overdose. And then that point person would contact, you know, I'd contact the family to find out, confirm the funeral home or whatever the services are.
Right, yep.
Okay, so the thing is, like, are we gonna, how many, let me back up. Are we going to have like an allocated amount of money already set aside and approved by the select board for prior to this? Because you don't want to have to like approve this, then go to the select board.
No, I would
So
think,
do we
right.
take out $20,000 a year
You set
for
aside, right.
families?
I think that's, if I remember too, you know, even just in talking with other folks who thought about this, and maybe when Brenda and others were here, that to me makes sense, that we would, if we were gonna go, and this may take us another, you know, month or two, and remember, we haven't even brought it yet to the select board, but I think we have to have a pretty clear-cut plan. We have to have the eligibility criteria. We have to have sort of the process laid out, and we're still thinking about and trying to figure out who would be that point person. You know, part of me says that if the RISE matching funds grant were to be funded, that housing/care coordinator might be a point person for, you know, someone from Belchertown, you know, or someone connected to Belchertown who needs it. But I would agree with you, Chris. My proposal to the select board would be, we want to try this. We've heard there's a need. We would like to have you approve X amount of dollars that Jill, as our town accountant, could make a sub account for.
Yeah.
And then you're right, you don't want to have to go in front of them, you know, every time a family wants to use this. So you've got a chunk of money set aside, and you gauge, you know, how quickly are you, you know, using those funds. And I would think, you know, it's hard to gauge, you know, what the demand might be. We know people want it. But I would think at least 20 to maybe 25,000. If we're looking at 5,000 per, you know, situation, then it's hard to know how long that would last, but at least that would get you through 4 or 5 families.
Right.
So I'm just letting you know, there's no audio on the video now. Yeah. I can't hear anything. So I'm assuming whoever is gonna be listening also can't.
Yeah.
Can you hear us now?
Yep, okay.
Yay.
Oh, thank you, everybody. All right, how do I get rid of this? All right, get rid of this settings. See, I said I was too positive about technology before.
We'll
All
get
right,
problem
so
solved.
Yeah,
we're okay. We're still recording, I
Teamwork.
think.
the four of us together make.
We've
one
got
team.
Mike, Mike,
I'm not gonna-
camera, action, and we're still recording. Okay, so apologies to anybody for the hiccup who might watch this eventually. All right, go ahead, Emma. So,
So one of the things we had talked about as a subcommittee is instead of having like your committee be the party that arranges all this, contracting out to a third party
contracting out,
essentially.
yeah.
So I had reached out to Elsa and Brendan, the nice folks who had spoke here and said, hi, Belchertown's interested in doing this. Do you know of any third-party entities out in our direction that are doing this? And they are in the process of expanding to other Mass communities in the new year.
Oh,
And
okay.
so themselves might be interested in
Halo.
Halo
yeah,
itself,
which
okay.
would be
Great.
probably the best.
I know, they
Yeah,
have
like
the
they're
whole
the blueprint.
system.
I wonder
right.
how difficult it would be for them to find out the cause of death, though, being in a different location.
I mean,
That might be a little bit more of a challenge.
and
Well,
that
I
might that honestly might make Belchertown a good pilot community for them.
Yeah.
Because the overdose death rate is so low.
You're right.
And so hopefully they'd have
Right.
time to build the connections they need in order to find
Yeah.
that information
Who
out
would, right, yeah,
before the
right.
overdose death
right.
occurs.
So that would be maybe connecting with, like you said, medical care providers, hospital, EMT, maybe in a number of different communities, because a Belchertown resident could also, or, you know, family of the overdose death could take place in another community, even if they're, so yeah, but they have the infrastructure already in place. They would just have to figure out, and then like you said too, Chris, maybe look, you know, in nearby neighboring communities or wherever for funeral services, because yeah, I'm only aware of Beers and Story and right in Belchertown.
Right.
But there's certainly others in Palmer and Ware, Granby,
And that might make this a good project.
Amherst,
to
right.
link up with other towns to do, so
Mhm.
maybe
Right.
this becomes like, you still apply for your own town's funds, but like
Right.
it's a collaboration between Ware,
Yeah.
Palmer,
Right, right,
and Belchertown.
Yeah.
right. That's
Yeah.
right. That's the other aspect of it too. Do you want to think about whether that's a collaborative effort?
So Brendan did say that they would love to find a time to discuss. So do we want to bring Brendan back to this meeting? Do we want to bring Brendan to our subcommittee meeting? I just want to know what to tell him when I respond later this afternoon.
I know, what's everybody think?
I think it would be helpful to bring it back here because I feel like we are familiar with the program now after speaking with them, and I think it would be great to like take it that next step
Right.
to talk to you about
Right. What would it
being,
look like?
what would it
Right.
entail to be a third party?
To
I
do
think
that.
that would be
Yeah,
really appropriate for you guys to hear that too,
Yeah.
you know?
Definitely.
and I know when they were here previously, they hinted
Right.
at
Right.
that they
Yeah,
could
they
absolutely.
For other
mentioned that was something
communities.
they were
Right.
interested in. So I'm glad to hear that they're like moving
Moving
forward with
forward,
that,
right.
so whatever we decide, the next.
Okay.
And
for
they're
the
cutting,
next
they're
meeting.
cutting ties with Boston Bullpen too.
Are they?
Yeah, because they're becoming a
Their own-
501 themselves.
Yeah.
Okay.
So, I mean, they're
Gotcha.
still gonna be
Yeah,
in
yeah.
high communication, but it's just, Steve told me that they were
Yeah.
Okay,
separating because they're becoming a 501 too.
right,
And that might change their bandwidth and we're in.
Exactly,
Yeah.
that's why I'm like,
right.
you know, or maybe, I don't know, maybe we should talk to them first. Well,
Talk to who?
no,
Will
I'm
you-
backpedaling.
Will you have a subcommittee meeting between this one and our next
Yes.
meeting?
Yeah, our subcommittee meeting we had put on the calendar is the 5th.
Of
January
January.
5th.
Yeah, okay.
Yeah, so.
Yeah, I mean, we could
Well,
talk about it at the subcommittee meeting. We have time to get to you, to get it on the agenda.
right,
And our subcommittee meeting is also a little more flexible, like if Brendan's not free
Right,
that time,
we
could
can
just
change
move
it, yeah.
Yeah.
And that might make it
Yeah.
easier then.
I think that, let's
Okay.
do that first, I
Okay.
think.
all right.
Makes sense.
And then my expectation is, you know, and obviously, you know, as other things come up, but I am hoping that, you know, when we're back in the January full committee meeting and subsequent meetings that I see this particular project as sort of the next big project. At our last committee meeting, we agreed that this is something we want to move forward. And as we get a little closer to RISE, is going to notify people in February, right? For January for matching. All right, so we'll start to get more information. The idea of working with Halo appeals to me since they have the infrastructure. Their application is very thorough. They've also experienced all of the little things that come up and can, the little things that could trip things up.
They're the originators of this program.
Right.
Like, they're the ones.
Right. And with all of the technology at hand, even though they might be based in Boston, they can quickly get money out to people. They can quickly connect up, get a payment made. And again, without having it, that may just be a quick conversation, with Jill as the accountant and get that money out. Because our goal was to be really efficient about it, because the last thing you want to do is make families wait. All right, so the plan is subcommittee will talk about it January 5th, maybe come up with some thoughts, ideas, even a mini proposal, come to the full committee meeting, which will decide the date in a bit. And then go from there. And then maybe at the January full committee meeting, again, this is a novel idea. This has not ever been presented to the select board before. We can talk about whether to go in front of them before we go too far down the road. If they don't feel like it's I hope they do. I think it's worthy, and we've heard from the community it's worthy. Not surprising that the vast majority is for funeral expenses, because there's really nowhere else to go to get funeral expenses covered in the event of an overdose death. So it makes sense to me that people would use it primarily for that. Okay. And then lastly, Halo, I'm going to make a note. Halo is becoming its own nonprofit, you said, Chris, right? Without the bullpen people, right? Bullpen was their nonprofit umbrella. Okay.
Yeah,
Branching out.
but they're still gonna be doing what,
Right.
their normal functions.
Right. Okay, cool.
Yeah, that's good timing on the email.
I know, right, exactly. Anything else from the subcommittee? Thank you for your work. I know it's an extra meeting. Anything else? Cool. All right, that sounds good. All right, let's move on to, and I know Angela is not with us today. We talked a bit at the last meeting about the community wellness resource fairs. I wasn't sure what we were calling it, but it is on the agenda, the program at the Clapp Library, the monthly program at the Clapp Library. I know, Chris, you wanted to just, see where things are at and see what makes sense going forward.
Yeah, so I sent it out to all of you guys. So Angela, took this over.
Yep.
And was putting together some type of like calendar program or something
Yep.
like that, which wasn't completed. And emailed me, which it should be the team, because it's not Drug-Free Communities initiative.
Yeah.
All right, I mean, we'll help, of course, but
Yeah.
like, so she emailed me about it and was like, oh, what am I supposed to do? And I gave her a list of all our nonprofit organizations, which we are connected to over 100. I have a list of contacts, and I was kind of hard pressed to think that only 2 people responded. She didn't use that list. She used the old list that Kirsten had.
Okay.
And even though I had sent her that, so it's just, it just seems to me like Kirsten had it.
Yeah.
She left. I ended up having it, I was like, oh, well, I got stuck doing it, which I don't mind when I have the time, but it's like the busiest time of year for me in the fall.
Yeah.
Not to mention personally, I had to take time off.
Right.
So, Angela said she could take it over. I know she volunteers with a lot of other organizations, but I just feel like it's been kind of thrown together. It hasn't. We need to come up with a structure
Right.
for it.
Yeah.
I'm a planner. Like
Mhm.
everything I do I'm
Oh, I
very
hear you.
deliberate
Right.
about
Yeah.
planning.
Yep.
And I feel like this is just kind of like, oh, it's that month, we better make phone calls now. Oh, let's do,
Yeah.
rush,
Yeah.
rush, rush. So I feel like we need to like
Pause.
pause it.
Yeah, let's put it
Definitely.
on pause. Mhm.
Hearing from Lauren and Kathy at the last resource fair and
Yeah.
Empower Health, Charlie Health was there, New Growth Recovery was there. We did, nobody showed up
Right.
from the community, but we made those
Right, and then
connections,
those
Yeah.
connections,
right? Like brand new connections, which is awesome. Like
Right.
this is what, what the other purpose of this is for us to make those connections. So, what we heard from the people there hosting tables is that a Friday afternoon from 3 to 5 is not a good time,
Right.
time-wise and location.
And location.
The location's in the basement of the library.
Yeah.
Even though it's a private location, people don't know it's even
There.
there going on. We're shoved in a corner.
Mhm.
It's just not a good
Yeah.
location. So, I'm thinking, why can't we use the town hall auditorium and do it during the day? I know it's good to have it in the evening because people
People
can
work.
come, more
Yeah,
people can
right.
come, but I don't know what is most effective. I don't know.
Mhm.
They do 3 to 5 at Palmer, right? Or 1 to 3.
1 to
One-
3.
1 to 3.
It might be worth like having Stephanie come do a meeting and just like talk about their process.
Stephanie from the Palmer
From
Public
Palmer
Library.
Yeah, talk
Mhm.
about, I
Yeah.
don't know how long they've been doing this, so I don't know how long it took to really like
Get people.
build
Right.
the participation they have, so it might be worth, I remember, Officer Burns came, that was the first
Yeah.
person
Right.
he came to.
Right.
But it might be worth having Stephanie go
Yeah.
too.
Right.
She's great.
And, and I hear you that I think we need structure. I think, we can look at opioid funds supporting it, but I also think we need to then be really clear sort of, who's organizing it, who's co-hosting, co-sponsoring with some opioid stuff. They, supporting it, but also is it a broader community initiative? My understanding is, the Quabbin Health District is still trying to fill that position for the public health nurse. So I think it makes sense to put this on pause until maybe that position is filled. Maybe we hear more about what happens with the RISE grant. Maybe we hear or think about other partners while we're also thinking about space, timing. I agree with you. Friday afternoon is probably tough. And then, again, the commitment of the opioid group for both people power, but as well as funds for goodie bags and food and everything else. So, let's put it on pause for a while.
And this is something honestly, I could probably pick up, but I need time.
Yeah.
I can't just
Right.
pick it up in a month and put it all
Right.
together for the next months
Right.
down the road. I'm like, I don't work like that.
Yep.
And, and when you work like that, it tends on being messy, so I
Yeah.
think it's a good idea for now.
I also think that as we think about some structure, who the partners are, how it's going to work, maybe new location, new date, new day of the week, new time. Let's also think about maybe an outreach plan to try to get to community people. Because obviously you want, your providers are there, you want community members to come. So then we think about, how does that happen? And again, what other partners might we be able to
That's been
to
important.
pull in, because that's also a big part of
Yeah,
it.
the marketing
Marketing
is definitely
right.
huge because, and like, that's been poor too, because that, we get the flyer a week ahead, we got the flyer a week ahead of time. It's like, we can go put it out in the community, but it's like on the calendar for, 2 seconds.
Right.
So I just,
Okay, it sounds like we're saying we're gonna go with a pause.
Yeah.
Maybe for at least a few months, I would say.
Yeah.
just to
Maybe
kinda-
start back up in the spring. or
I know
something like that.
spring, which might even be more amenable to, people coming out for
Yeah.
something.
But
But-
in an outside space.
I know, there you go.
And then
Maybe
people
in
can
nicer
see it.
weather,
Yeah.
outside space. could
Yeah.
be. Think about other options. All right, so it sounds like we're in agreement. There was not anything for December, because that's right, the holidays are here. So let's, skip I would say January, February, maybe even March. Give ourselves plenty of time to see, but for now we're on pause. Okay. I think that makes total sense. And then we can think about, again, I would just toss out the idea as well. Is there anybody, in the community for whom helping with this could be a stipended position? Could opioid funds, not only thinking about the refreshments and maybe goodie bags and other kinds of things that would be a part of it, just tuck the idea in the back of your brain, could a very, time limited person, would that be helpful? Particularly maybe around the marketing piece.
Yeah.
So just think about it. I think I'll go back to the state subdivision agreement, but I think that kind of staffing or even a stipended position that would fly. Anyway, just a thought because it is a lot of work to put it together. It's like a mini health fair every month. That's a
Yeah.
huge thing. So,
Yeah, but
Okay.
once you get the structure down, it's
Right.
gonna, once
Right,
you get the initial
right.
structure down, it'll be a breeze. It's just a matter of figuring that out.
right, exactly. And having players involved,
Yeah.
like
Yeah.
a public health nurse and others. Yeah. Okay, cool. Any other thoughts on that? I think we're good. We agreed. We're gonna do a little pause. Excellent. All right, it's a little bit before 11. I just want to get through a couple of quick things, and then we figure out our next meeting date. Quick update. I know those of you who just love to watch select board meetings probably were glued to your televisions now on December 1st. Hopefully not. Hopefully you found other things to do. Chris and Sean and Aline were there. 2 young youth from the Helping Hands group were there. So we presented to the select board what this committee had supported, which is folks going to the CADCA conference in February down outside of Washington, D.C. The 2 youth spoke very eloquently about, what they think they would get out of it, the value of it. So the select board approved it. They were very happy to do so. They would also just like to hear more after the students and the adults go to the conference. What did they learn? How do they bring it back? How do they apply it to their work? And we left open the possibility that the students could always come back maybe before the school year is over. As they come back, sort of digest what they learned, start to apply it, and then, think about what it meant for them. I think they were both juniors, right?
Yes.
So, yeah,
Yeah,
so
we're
that's
taking
good.
5 juniors.
So, excellent. So they're not graduating next year. We get another year out of them. And lastly, I guess I would also encourage, depending on where things are with drug-free communities and monies and, the conferences, this could become an annual request. I think it's a reasonable request. It does cost a fair amount, obviously, to send people down to Washington for multiple days, but just something to think about, or even cost sharing it. So maybe partly opioid funds cover the cost and then partly, a drug-free communities budget or whatever other resources. But the good news was the select board liked it. They approved it. In general, they're very supportive of prevention. So I think that was great.
So drug-free communities, I just looked at their posting of the grant today.
It's not up yet.
No, and there's 2 different ones though for year 6, which I wasn't.
Yeah, oh, is there?
Yeah, there was one
I
for
didn't
like,
look for those. I looked
there
at
was
the
one
year
for 20, it says 2025 cohort on it for year 6, which I didn't understand. And then it says continuing one under it. There's 2 2026s.
Okay. Oh, that's
posted.
interesting. I don't,
Check it out.
okay,
I think we're the 2025 cohort because we have the gap year.
okay. Oh, that could be.
I
Right,
think that's what that
could
is.
be, right.
But then who are the,
That would be
continuing-
someone who's a year 5 right now, under
oh,
funded,
that's what it
and
is.
would
Yep,
go
yep.
into year 6
Right.
as of July. So without the gap, you're right. They're making a differentiation between anybody with a gap who's gone through 5
Right.
years. And
And the
then
ones
those that are
picking it.
going right through from a year 5 right now.
Yeah, so that one, we'll know by June 1st.
Yes, they changed their time frame. The
Right.
grant starts July now instead of
So we're gonna have to
September,
look
so-
at that for us, because if they change the time frame on it, we'll get that money in June now instead of October,
Instead of October.
which you guys have covered. I mean, the opiates
It's a
so,
good point.
so we'll
Right,
just have
okay,
to
we'll
revisit it.
see.
Yeah.
Yep,
We're
we'll
gonna have to
see how
revisit
that-
all
okay,
that.
cool. No,
So-
that makes sense to me. One caution I would encourage you to take a look at, because of what happened with the year 1 and the year 6 applicants back in the spring, with the, complete, saying we're not funding those. Take a close look at the Office of the White House's executive orders that you have to comply with.
Yep.
Oh, yeah. In order to, or at least you have to state that you
We-
are in agreement with those. And some of them could be seen as completely antithetical to prevention, and that's all I'll say about that.
I'd argue that most of them are.
Most of
Yep.
them are, but it was very clearly stated even on the forecasted
Yeah. right at the
grant
bottom of the forecast.
opportunity. And yours truly will be looking at the details of some of those executive orders, but they are expecting compliance with those executive orders, which I think is going to put a lot of prevention folks in a really difficult spot. Anyway, see how that goes. Take a look at it, looking at the application. Again, at least for now, the select board has approved the drug-free grant to be funded all the way through September. So we'll see where that goes with the change at the federal level. Cool. All right. Any updates on the town, the webpage? I don't think so. I think our webpage is looking pretty good. I know folks are, digging out stuff. If you come across new resources that are maybe new to the area or have expanded their services or anything you want to let, maybe send stuff to Jill, because Jill has access as a town employee. She can just go in there and she can make those updates on the webpage. But if you come across anything new that you think would be useful for the committee's webpage, by all means, do that. Lauren, let me turn to you. Any updates or things you want to let us know about the countywide, the Hampshire Hope, facilitated meetings and all that?
Sure. Thanks, Gail. I think most of you are aware that we have our next regional meeting this Thursday. And I know that following our last meeting, one of the hopes for this upcoming meeting is to really do some mapping across the region to see what are existing and shared available resources, to then really be able to determine what the gaps are or the opportunities when thinking about how municipalities can be utilizing their funds. So hoping to spend some time doing that. I know some communities where did their survey this past fall. Amherst, I know, has some preliminary data from their survey. We are starting to finalize the regional survey data. And so I think there will also be some great opportunities coming up for some information sharing from community input and feedback to help inform decision-making moving forward. So I'd say those are two current updates. Yeah.
Great, excellent, thank you. I know I've been thinking next month will mark 2 years since this committee was officially formed and started meeting. Yeah, 2 years already. And I've also been thinking about what kind of any additional, data gathering, interview, it might be time to just figure out ways to sort of check in with our community. So yeah, Lauren, anything that you have from survey, other, Bay State Wings Community Health Needs Assessment has just officially been posted and come out. Obviously, substance use and the impact of it and opioid use are still huge community needs from their perspective, from that assessment's perspective. So anyway, just thinking about, down the road, what other kinds of community input gathering methods might we use? And then hopefully with any luck, I'm hopeful that Western Mass gets a decent share, if it's not us, a decent share of some of that RISE matching funds money, knowing that Palmer applied, Belchertown and Ware and the Recovery Center together. So anyway, keep our fingers crossed for that. Great. All right. So next meeting, Lauren, Thursday, what is that, December 18th? Is that right? I have that date right? Okay. Hopefully everybody's on the mailing list for that. All right, last but not least, I've got other stuff on here. We've already talked about the support fund. Nothing really happening around that social worker model. We'll sort of wait to see what RISE says, wait for RISE and their decision making. Anything on mobile harm reduction services? Anything new to report there?
Not on specifically mobile services, but I have been working with Pedro on getting a vending machine for Ware.
Okay, cool.
So hopefully that will happen sometime soon. I think probably after the holidays, we'll talk more about locations. And I know he wants to come out and kind of get a lay of the land of Ware. And also Emma was at Tapestry in Greenfield on Friday to go over some of the drug testing stuff because we want to bring out some drug testing to this area as well.
Okay, cool.
So we're moving ahead.
Excellent.
Still a bit steady. Yeah.
That I'd be interested in, once
Yeah.
we've moved forward, particularly with both of those
Yeah.
initiatives, is that anything that we could look at depending on cost and location and whatnot for Belchertown, particularly a vending machine with
Yeah.
all the supplies in it, like they
Yep.
had in the Berkshires,
Yep,
right?
yep.
when you
It's
were there?
actually from Berkshire Harm
Right, so from
Reduction.
your
For
former,
my former
Right,
job,
yeah.
Sarah, my old boss from Berkshire Harm Reduction, reached out to Pedro about an extra vending machine, and he immediately thought of Ware. And I think there's
Wow.
another vending machine that may be up for grabs that Berkshire Harm Reduction gave to Worcester, but it seems like Worcester hasn't put it up yet. So Pedro was thinking about reaching out to them, and if that comes through, I was going to suggest Belchertown because
Okay,
we both already have our needle exchange, our SSP approval from the boards of
right, from
health.
the two boards of health, right,
Yeah.
exactly, right.
So we can do that
Cool.
very easily.
Ooh, that'd be interesting
Yeah.
to. Lauren, does anybody else have vending machines in Hampshire County that you know of?
Not that I know of, no. So,
Discussion?
yeah, Emily, please, if I can be of any help to you and Pedro in next steps, I think that would, I'm really excited about that. And I think that
Oh,
is
that'd be really
so
interesting.
necessary.
They are so cool. You can get all of your clean rigs and stuff like that out of them, but also like there's condoms, there's
Right,
naloxone.
exactly,
there's-
exactly. And
We
it's-
had Plan B in ours at
Right,
Berkshire County
right.
and stuff like that. So
Yeah, right,
They
and
don't
it's,
have them in Northampton because they just have Tapestry.
yeah, they just have
Right.
Tapestry has all
Yeah.
those resources already.
right, right, but
But a
and
vending
no,
machine
I
is.
was gonna say, vending machine is 24/7,
Yeah,
depending
definitely.
on where you put it,
Yeah.
right? And with all the great providers in town,
Yeah.
people are allowed to not work on certain days.
Yeah.
And I feel like it's and I feel like it's a model that I know other communities have thought about or have explored. And so I think being able to have Ware be an example in Hampshire County to integrate and implement, I think then could be a really good like jumping off point for other,
Right,
for a nice ripple effect.
right,
Yes.
exactly.
Yeah.
So,
Yeah.
And yeah, it's sort of just, it's like, to me, it's like Narcan in common places that you encounter it now. It's like, oh, there's a vending machine with all
Yeah.
this good stuff in it. And that's just, a community health thing right there.
Yeah.
And it's perfectly normal to do
Yeah.
that.
I will say the stipulation that I'm going to put in place is that it is in a location that is 24/7 accessible.
Accessible, right,
Because people are going to want to try to hide it.
right. I know, I think that's, that is a challenge, right? Where do you locate it?
Yeah.
How visible is it?
I
For
want
some people that visibility is a good thing, and for other
Yeah.
people that visibility, yeah.
I'm
So,
thinking behind E2E where they do the methadone ban
Yep,
would be
Yeah.
a perfect spot.
For the folks who might want to patronize it, they're not like right
Yeah,
out.
it's on
But it's
Main
still an
Street.
right, it's
place.
accessible place, right,
That's
exactly.
like,
You
that's
want
that,
it,
you want
right.
Yeah.
to know where it is, but you also don't want people uncomfortable
Right.
using it.
Yeah, and I just know that in speaking with people on the methadone ban, because I've asked them, like, do you have a lot of people asking for other services? And they have said that they've had people ask where they can get needles and
Yep.
clean rigs and stuff like that. So having it in a spot where they're already comfortable going
Right,
would be
exactly.
huge.
Right.
So I just gotta contact the bank, try to sell it to them. It's okay.
I
Cool.
promise, it's fine, it's good.
Or I could just put it there. I'll see if they notice. Dress in all black.
Well, you let us
Same.
know. I would love, maybe once Wares is up and
Yeah.
running and installed, that, our committee could take a field trip and go check it out. Because I've only seen them in presentations and on slides. I haven't seen them. in
They are
person.
very cool.
So
they are
I'd
very
like
cool.
to see it in person.
In
Cool.
Tapestry, Pedro said they would restock, they would come out and
Right.
check on it and do all of that themselves,
That's
so.
some of the trickiest
Exactly.
part
But yeah.
about them, so
Yeah.
having Tapestry.
Exactly. And again, if this committee needs to look at, how can we invest in something in Belchertown, both staffing wise with Tapestry as a partnership and or just the physical equipment.
Yeah.
That's needed to have a vending machine and for the supplies themselves. Yeah. I think that would be really cool. So, all right, cool. Well, that sounds great. Moving along. Keep us posted on that. I know Neil is not with us today. I don't know, has anybody got any updates on transportation? Lauren, I know you've been involved with the transportation group.
Yeah, I
Anything
can share
bubbling?
some, and I think there are others from our partners who can also chime in too if I forget anything. But yeah, so there has been this past October we did a Eastern Hampshire County regional roundtable discussion around transportation access for justice impacted individuals and folks with lived and living experience with substance use. And there was a lot of energy, and so folks wanted to stay connected. So we met again 2 weeks ago and are mapping out. Julie Lutz and I have been building out like a standard operating procedures, community expectations around a regional like WhatsApp group. I think something that came up was like having like an informal way of being able to like coordinate transportation for folks, whether it's to treatment or to doctor's appointments or to meetings or to whatever the need is. And being able to have that as an outlet, it was something that had come up in the October meeting. So hoping to do some piloting of that with some like kind of core key partners in the new year, and then do some assessment, and then having it be something that's available for folks within our communities. Am I missing anything? Please feel free to chime in.
No, that sounds like what we've been up to.
Cool. Thank you both. That's great. Again, anything this committee can do or any way we could support anything by recommending investment in anything, money wise and otherwise.
Oh, I do have
Sounds
another
great.
update. I'm so sorry about
Oh, go
transportation
for it.
that I think would be especially helpful for this group, because I know that Belchertown was instrumental in this process. Our partner from PVTA did share in the last meeting that their application for an additional route for funding to support an additional route that would include Belchertown, where Holyoke was approved, and so that there will be steps for implementation. Probably, it sounds like won't be until the spring, but
Okay.
there's progress there. So that was very exciting, and I know Neil was really instrumental in facilitating that process. And so, sorry, I didn't share that first. That was very exciting news. So that was also another transportation update that did.
Excellent. Great. One thought I have too is that whether, again, if this committee and others in town can help let people know about that once it's up and running, as well as maybe get it on the webpage and other ways to, if there are additional options under PVTA with additional routes, then we could let people know that as well. The town has a regular sort of all kinds of news and updates, Carriagetown Chronicles it's called. So yeah, there's ways to maybe get the word out if there's additional. That's great, because I know it's not always easy for PVTA to both get those resources and justify additional routes as well. Excellent. Any other updates, anything anybody wants to share? We've talked about some of the projects we've already explored. Ready for the next meeting date? All right. What's the preference? The 19th, when we would typically meet, of course, is the great Dr. Martin Luther King holiday. So that's one of those instances where we're there. Do you want to go before? Do you want to go after? We could meet, if we're going to still meet Mondays at 10, we could look at the 26th, the week later after the holiday, or the week before, the 12th.
I'd book the 26th
Okay.
because that way we have our subcommittee on the 5th.
Yes, you're meeting on the
And
5th.
that will only give us a week to like get back to you.
I
So
like
like that
that
way it'll give us
idea.
more
Yep.
time if we want them on the agenda and set that up.
Yeah, 26 would,
UHSUA
yeah.
meeting is also the 12th.
Yeah.
so-
Oh, okay.
Okay.
Yeah, right, that's
Yeah.
right, because you run into Monday holiday problems as well, I remember well. All right, so we're agreed on the 26th, toward the end of the month, we'll get that out. All right, excellent. Yes, I agree with the subcommittee meeting and some time. All right, I guess I will make a motion to adjourn our meeting. It's about 11:17.
second.
All right. Gail motions and Emily seconds. All those in favor? Aye, all right, so we are adjourned, 11:17. To anybody watching the recording, to our folks here, happy, safe holidays. When we're back as a full committee, it will be the year 2026. So we will see you in 2026. Thanks, everybody.
Thank you.
Thanks, Lauren.
Thank you.